There's about 40 different types of hantaviruses, and they cause two distinct syndromes. The one that we're more familiar with here in the US is hantavirus pulmonary syndrome. But in other parts of the world, different strains of hantavirus can cause hantavirus-related hemorrhagic fever and renal syndrome. And so those are two separate clinical entities. So they're spread by mostly contact with rodent droppings or direct contact with rodents themselves. And the different rodents will vary depending where you are in the world and the species of hantavirus. It's not very common. So in the US, we generally get between 20 and 40 cases every year. Where you're going to get it in the US in the West is from the deer mouse. And the deer mouse is primarily at elevations above 2,900 feet in California. These are areas that are mostly in the eastern Sierras, where we see the vast majority of cases in California. So people, for example, who live in the Sacramento area or in the Bay Area at basically sea level elevation, there's no risk from the house mouse or regular rats or squirrels or other rodents in the area. So the hantavirus pulmonary syndrome, where we see in the US, which is primarily caused by sin nombre virus in the West, that's not transmitted person to person. But other hantaviruses may be transmitted person to person. For example, the Andes virus may be transmitted rarely person to person. It's generally due to very intimate contact. So for example, couples who are sleeping together are very close, or caregivers like a nurse and a patient, somebody who's very close. There's been other reported outbreaks related to, for example, a very crowded birthday party where people were very closely together for a prolonged period of time. So it's not common to be transmitted person to person. So the symptoms that we're most familiar with in the US with hantavirus pulmonary syndrome is this acute onset of really severe respiratory failure. It generally starts with vague symptoms, something like fever, muscle aches, nausea. But then after a few days, it can have rapid development of pulmonary edema, where fluid leaks into the lungs, and then there's really a severe decrease in oxygenation that occurs. And so the lungs can't really absorb oxygen, and this becomes very severe, so that patients with this need to be on ventilators or even on heart-lung bypass machines. The primary treatment is supportive care, and so patients need to get enough oxygen, have enough fluid, make sure that their blood pressure is supported. And so this dramatic, it's really a dramatic illness when patients need this respiratory support. They rapidly go from breathing room air to require high levels of ventilatory support. But the good news is that if you give the patients that support, within 1 to 2 days, they can make really dramatic recoveries. Well, it's always a good idea to practice good hygiene, and you know, if there's rodents or rodent droppings in the area and you're cleaning up and aerosolizing things by sweeping, good idea to wear gloves and a mask. But if people are cleaning up areas that have had rodent infestations, I would encourage them to look at the California Department of Public Health website, and they've got excellent information about how to do that safely.